So I just wanted to say welcome everyone. I'm Sylvia Howes and I've got some of my awesome Data for Good team members behind the scenes. So Samantha and Kiani are moderating that. So we're hosting this webinar from the lands of the Wongal, Darawal and Gadigal clans of the Eora Nation. So I'd like to acknowledge the traditional custodians of the various lands on which you're all on today and the Aboriginal, Torres Strait Islander and Maori people attending the webinar. We pay our respects to their elders past, whose understanding of the ecosystems nursed country. We pay our respects to their present elders who continue to pass on knowledge and provide guidance that we can all learn from. And we pay our respects to emerging community elders. We hope they continue to find means through which their voices are heard and registered. We celebrate the diversity of the Aboriginal and Maori peoples and their ongoing cultures and connections to the land and waters. And although today we celebrate all people as part of the UN's World Population Day, we recognise with respect and solace the toll it has taken on the traditional custodians of both of our nations. We hope we're able to identify ways to bring solidarity and equity to the challenges being faced. So with that in mind, keep an eye out for our invitation to our special World Indigenous Peoples Day webinar, which we'll be celebrating on the 10th of August. So this year, World Population Day calls for This year's World Population Day calls for attention to a meeting that was held 25 years ago, actually, the 1994 International Conference on Population and Development. And since that landmark conference, where 179 governments recognise that reproductive health and gender equality are essential for achieving sustainable development goals, there's been a lot of progress made. There's still some areas that we can improve though. So with nearly 20 years in federal and state governments and roles in policy, advice and performance reporting, I like to think that Michael heard that call 25 years ago. He's responsible for the primary and maternal health and veterans group at the Australian Institute of Health and Welfare. The group has a variety of roles, including preparing data from the My Health record system for public health and research purposes, producing the national data on maternal and perinatal health, and partnering with the Department of Veterans Affairs to develop a repository of data and quality statistical reporting about the health and welfare of Australia's veteran population. So with that, Michael, I'd like to say welcome and hand it over to you.
Thank you very much, Sylvia. Thank you for the invitation today. I will just try and share my screen now. Aha, there we go. So
yep, we can see that.
It's come through, very good. Yes, so, and today looking obviously with World Population Day and that call from 25 years ago, particularly looking at women's health and reproductive health in a presentation I've got here after a little bit of sort of describing what we do, because a lot of people aren't aware of the Institute of Health and Welfare. So I will talk a little bit about that first. Stronger evidence, better decisions is really, that's a subset of the things that are in our strategic direction, but it's the broad premise under which we operate. Our job is to, we were set up over 30 years ago as the Institute of Health and expanded some 8 to 9 years after that into the Institute of Health and Welfare to have a broader emphasis. And our role is to produce authoritative, accessible information and statistics for the nation on health and welfare, with the aim of supporting better policy and service delivery decisions and leading to better health and welfare for all Australians. Our job then is to try and turn data into useful information to allow people to do that. So really, we're not involved in improving the health and welfare of Australians, but our job is to try and support those who do. We're an independent federal government agency. We are within the health portfolio, but we are overseen by a board. And so that's very important for a statistical agency to be independent, of course. And we have a very strong act that governs what we do and how we do that independently, but also how we manage privacy, for example. and our Act actually predates the Privacy Act, but also is stricter in many respects. Some key ones being that given that we hold information from the National Death Index, we respect the privacy of dead people as well as alive people, which the Privacy Act doesn't require, but also of providers, which again, a lot of our information is administrative information that comes from them, so that's very important. We are very engaged in our particular areas, including having a range of expert advisors and advisory committees, both to help us understand the data, but also to help contextualize it and to make sure that we're putting the right information out there. Again, saying that our idea is to provide stronger evidence that can improve decision-making and service delivery means that we need to ensure that we're putting an emphasis on the right things. And in doing these roles, we make some 200 releases a year, more than 200 releases a year. It says reports there, but actually we're increasingly providing information online rather than the form of an old report, with dynamic visualizations and things so that people can interrogate the data in their own way. We cover 75 different health and welfare topics. And then we also have a role, aside from that public reporting and information type role, we also have a role to provide information for researchers. Again, they are people who can take that data further and help improve health and welfare by understanding issues a bit better. We are in that role as well. We're what's called a accredited linkage authority, which means that we can bring sensitive data sets together in order for that information to be more powerful, and we can then provide it in a secure way for researchers. We have protocols around that, of course, to ensure the privacy of the people in that data, and similar things to the 5 safes that people might have heard of, but also the separation principle, so that people who see identifying information for the purpose of doing linkages don't see any content information, and vice versa. So that's what we do. We hold a lot of data. We're data custodians. We manage it. We aim to improve the data quality and standards of that information, to make it accessible, to help researchers, and try really to inform the public, inform decision makers, and inform people about their own health as well. Because in terms of people making better decisions, it's not just policy people and service deliverers, but also people can make better decisions about their lives as well, if they understand some health risks, for example. So we use this framework. That history I sketched out before as the Institute of Health first, and then later becoming the Institute of Health and Welfare, which was a much broader remit. We are still probably disproportionately in the health sphere. Partly that's to do with our history, partly it's to do with the fact that, you mentioned in the past being involved in Co-Ag Reform Council, where I had a much broader remit there too. Working across different sectors, the health one is the one where I think, just by virtue of that sector, they start from the premise that data is a good thing. So that's another reason why we're disproportionately in that sector. But we are looking through our person-centered model to try and broaden and make sure we're covering all of the potential influences on people's health and welfare. So this model really helps guide where we try to fill gaps, and particularly we have some collections in health and housing, justice and safety and social support. Those are the areas where we're strongest, and we're trying to build up understanding of income and finance and employment and education as areas that we need to really get into a bit more. This also helps us to sort of think through the concepts of, what are the interplays of different areas of people's lives. Obviously, we look at health, for example, by geography, but sometimes that geography is really about wealth and income, which in turn is obviously a lot about education. So we're starting to look at ways of, reporting information, which we recently did on cardiovascular health by education status, highest level of education. And as we expect, in many cases, people with higher educations were healthier in cardiovascular terms. So these are kinds of questions that we start asking about the data to inform, as I say, people, decision makers, and deliverers of services. Again, I need to emphasise here, and obviously, and this is a bit of a focus for us at the moment as a general rule. While we say it's the person-centred framework, it's not really about identifying an individual and knowing everything about them. We are heavily focused on maintaining privacy and the security of the information, and ensuring that we don't put out anything that people can re-identify people in. Our aim really is to ensure the information is useful. And I think that's a key part of the discussion in the present environment, where we are seeing, if you recall recently, the My Health Record opt-out debate, but also things like the Cambridge Analytica with very targeted ads being used in an electoral context, that it's contingent upon those who are using data to do good things to start telling that story, because I think a lot of people really now are scared of data and big data, and with some legitimate concerns, obviously, but also if that ends up with there not being the data we need to do good things, then that can be problematic. So I think organisations like the Institute of Health and Welfare, where we largely haven't been involved in that space, are increasingly trying to focus on explaining some of the things that come from the data and how that can be helpful. And that's important in that context. Again, going to the different things coming together, increasingly trying to work across the data collections to understand how different elements of a person's life affect other parts. And, you know, people often talk about the social determinants of health. My CEO likes to talk about the social determinants of everything, in part because people pick that up and say, well, why is it always the social determinants of health? Why isn't it the social determinants of education, or the health determinants of education? I mentioned before, we have done some work showing people with higher level of education have better cardiovascular health. Equally, I imagine, and we have yet to do the work, but there's a relationship between people's health and their ability to participate in educational work. So it works both ways. So some of the things in terms of, we recently, in December 2019, put out a report on the health of Australia's women, which you'll find on our website. Much of what I talk about in terms of the actual data here comes from that report, but also from reports that come from within my group of the AHW in the perinatal and maternal health units, such as Australia's Mothers and Babies, and our work on stillbirths and neonatal deaths. We have a range of data collections that tell us some things about women's health, which are very important to World Population Day, given that call from 25 years ago about gender equality and reproductive health. So among the findings in that report, in terms of those sort of questions about what does data do, how does it help, and why is it important? Well, some things one of the things it does is it tells us what's happening in the service sector and what's happening to people. So in 2016-17, for example, there were some 34,200 hospitalisations related to endometriosis, and about 80% of those, or 4 in 5, were women aged 15 to 44. We know, now obviously there's, with endometriosis diagnoses, this can relate to age. Obviously it takes some time sometimes. So the way we look at the data depends on when people were born. But in that report, 1 in 9 women who were born in 1973 to 78 were estimated to have been diagnosed with endometriosis by age 40 to 44. Looking at a younger cohort from born in 89 to 95, about 1 in 15 of those women were estimated to have been diagnosed with endometriosis by the age of 25 to 29. So this is a significant proportion of women are affected by this condition. It leads to a lot of hospitalisations. which shows you, we don't have other information, but if you're hospitalised with endometriosis, obviously it's quite serious. So that's a measure of the seriousness with which it does affect some of those women. And that amounts to 281 hospitalisations per 100,000 women, with about half of those. So I don't know how familiar you are with hospital statistics, but hospital statistics are classified by the principal diagnosis, the reason you're there, and secondary diagnoses, which are other things that are noticed while you're there. But so of those 34,200 hospitalisations, about half of them, a bit over half actually, had endometriosis as the principal diagnosis. So that's a significant area of women's health that can get some focus, and which we understand a bit more now by drawing these data out. Also, most recently in that report, so data helps people to understand what's going on and how that might affect them. So obviously, sexually transmitted infections are very important in terms of reproductive health as well. In 2017, there were over 66,000 new cases of notifiable sexually transmitted infections reported for Australian women. These are key things to note of that is that the cases for viral hepatitis and HIV have been stable over time in women, but there has been an increase in rates of chlamydia, gonorrhea and syphilis. And those increases were particularly noticeable with gonorrhea and syphilis, more so than chlamydia. The rates of gonorrhea in women were twice as high in 2017 as they were in 2008, and rates of syphilis were 4 times as high in 2017 as in 2008. This is a growing concern, obviously, as that grows. And one of the things, so I know it says data helps you manage risk, and that tells people that there's a greater risk of sexually transmitted infections, but it also helps response to those sexually transmitted infections. And there are programs now that are focused on this increase and how to turn that back around. In terms of then perinatal and maternal health, we have a mother's page on our website if you want to look at that, which shows some of these statistics. In 2018, some 298,630 women gave birth, which was 2%, an increase of 2% from 2008, so over 10 years. Obviously, the population got bigger, so it's a decline in population terms. And a decline from a peak of 310,000 women giving birth in 2016. These rates ebb and flow over time. So we can see, I mentioned, while it was an increase in terms of numbers, it's a decrease in the rate. The rate of women giving birth was 65 per 1,000 women in reproductive age in 2008. And by 2018, it was 58 per 1,000 women in reproductive age. This is the story of partly a change in birth rates that comes as countries get wealthier, but also ageing of the population and a number of things like this. Of those who did give birth, the average age of all women who gave birth is getting older. You can see that on the slide there. So in 2008, the average age was 29.9 among all mothers. And in 2018, that had risen to 30.7 years. At the same time, the average age of first-time mothers is also increasing. So those who gave birth first time in 2008, the average age was 28.2. And by 2018, the average age was 29.3 for those who gave birth for the first time. The other information we have about mothers, in 2018, about 4.6% of all mothers who gave birth were Indigenous. and that's slightly higher than the proportion of Indigenous women of reproductive age in the population. Also, Indigenous mothers were more likely to be younger. Going back to service responses and how data can help there, one of the key things is antenatal visits. We know that that leads to better outcomes over time. And the aim is for people to have, I think, 7 in the course of a birth. And we do measures across that. So almost all mothers who gave birth in 2018, so 99.8%, had at least 1 antenatal visit. But if you look at those who had 10 or more visits, which is a good sign, that figure drops down to 57%. So still some work to do there to ensure people are getting that antenatal care that they need leading up to births. And people are working on doing that, but at least people are getting some antenatal care. One of the things about Australia is, in particular, it is among the safest countries in Earth to give birth and to be a mother, and safest for the babies as well. But there are still risks, and they are minimised by more antenatal visits. So one of the things that can be a risk, obviously to the mother for different reasons, but to babies, is smoking during pregnancy. So in 2018, 10% of mothers who gave birth in 2018, well actually 9.6%, smoked at some time during the pregnancy, which was down, very good, from 14.6% in 2009. Some of the other risks, half of mothers, so 47%, are overweight or obese at their first antenatal visit, which is among the things that is tested when you have those visits. And the proportion of mothers who were overweight or obese increased with age. So that risk increases, and obviously the age of women giving birth for the first time and also altogether is increasing over time. So that's an area of potential increasing risk there. In 2018, gestational diabetes affected 135 out of every 1,000 mothers who gave birth. So there's another risk factor in pregnancy. And one thing that people particularly focus on, we do also do information on the caesarean rates. So 2/3 of mothers in our most recent figures had vaginal births, and 1/3 had caesareans. That caesarean section rate has increased by 4 percentage points since 2008, from 31% to 35% in 2018, and a corresponding fall in non-instrumental vaginal births. So this figure, while it has increased a little bit recently, is generally stabilised and mostly clinically indicated. So there's a lot of discussion about the caesarean rate, and we're careful to say that these ones are clinically indicated. So I mentioned as well, Australia is one of the safest places in the world to give birth, and maternal deaths are rare in Australia. But some women do still die during pregnancy and following birth. The maternal mortality ratio, which we do, as I mentioned, fortunately the numbers are small, so we do trienniums. We have to do 3-year data to get statistically meaningful numbers. The maternal mortality ratio was 6.4 deaths per 100,000 women giving birth, and it's the second lowest ratio that we've reported in any triennium in Australia. So that has been decreasing over time, but relatively stable in the last few reports. And the direct MMR, so deaths resulting directly from complications of pregnancy, that's declined from 8.3 per 100,000 women who gave birth in 1973, 1975, to 2.5 per 100,000 women who gave birth in 2015 to 2017. So that's a very positive story, but obviously within that, there are some differences with different populations. The ratio is higher among women who identified as being Aboriginal and Torres Strait Islander. It was higher among women who were aged 35 or over. and was higher among women who had given birth 4 or more times, and those who had smoked in the first 20 weeks of pregnancy. So these are some of the information that helps guide programs to try and manage these issues and reduce the risks, with a view to reducing the number still further of women dying in birth. So this is not women's reproductive health, but it is one example we give of how data, I mentioned before that it's contingent upon us to, as a data agency, to start explaining the good things that come from this information that's collected about people. And this is an example here where we were asked to monitor the health checks of Aboriginal children in the Northern Territory. And this has led to this program now to expand nationwide from just that area. If we look here, you see it's not all good. One of the statistics is going up, but one part of focusing on those health checks, where we've seen some good results of these data and the use of the data to guide programs, has been in tooth decay, where at the start of that program in 2009, you can see there 73% of 1 to 3 year old Aboriginal children in the Northern Territory, 93% of 8-year-olds, 75% of 11-year-olds, 81% of 12-year-olds had some tooth decay. And in 3 of those categories, it's gone down, and quite a lot in the 1 to 3 year olds in particular. That's just one quick example. Another is the rate of stillborn babies in Australia hasn't declined for a long time. And this was a subject of a Senate inquiry recently. We were able to inform that inquiry with data, but also it made a number of recommendations about stillbirth and neonatal death information, which we have been dutifully implementing to improve the collection of that information, to improve its frequency and improve the detail that's made. So looking that while the overall perinatal mortality rate has remained relatively unchanged for 20 years, we have seen some decreases among babies born of at least 23 weeks or more gestation, babies born to Indigenous women, and deaths occurring in the third trimester of pregnancy. Those areas are improving. We're looking at improving the reporting on the timing and causes of death and autopsies, and improving the presentation of that information to help people to look at those areas that aren't improving and try to bring the overall rate down. That's obviously an important piece of work. We're participating in the Stillbirth Roundtable and the National Stillbirth Project Reference Group to continue to improve and provide input at the national level to help with the development of and implementation of the National Stillbirth Action and Implementation Plan. So this is ways in which data can achieve good. So this would be fewer deaths, basically, is one of the good things that people want. And I think we can all agree that we should be trying to reduce deaths in childbirth and among women. So that's everything from me, and I think we'll have the next presentation from Jannat and then some questions after, and I'm happy to answer questions. I guess the key thing to emphasise is that we are early days for us in trying to explain better about how the data helps the world in this current context, but keen to continue to do so, and I'm happy to talk to people about that after this presentation as well, and my details are shown on the presentation there. Thank you.
Great, thank you so much, Michael. I think you've really captured the idea of what you can measure, you can manage, and the idea that you need the data enabled to be able to to know where to focus the programs. So it's really fascinating. And yep, we'll keep you around for Q&A afterwards.
Thank you.
Thank you. Now, Jannat Maqbool is an accomplished academic, CPA, and former CIO. She's currently the Director NZ at Smart Cities Council ANZ, New Zealand lead at the Centre for Data Leadership, Smart Cities Advisor for Hamilton City Council, and Principal Advisor for Asia Pacific in IoT, Agritech, and Fintech with ecosystems. So basically you can say her name is synchronous with Smart Cities. She's a passionate advocate for digital inclusion and is involved with a number of initiatives focused on digital enablement. So welcome, Jannat.
Great. Thank you. First of all, wow, Michael, hello. Like, I've got to go after you. Could you have possibly have gone after me? And I love the how data helps the world, and I really applaud you on the work that you're doing. So what I'm going to do now is share my screen, and I will go from there in terms of my presentation. I just have to figure out how to do this. So yeah, I'm going to talk about smart cities. We've touched on that. So about specifically around open data, data leadership, and the intelligence of things for smart cities, which I thought I invented the term, but I actually didn't. It turns out somebody else used it previously. Anyway, so as a sort of a start, just to give you an idea about where I'm sort of coming from. So the Smart Cities Council is a global organization. Since 2012, we've been around, started in Seattle, and now we're in several countries and continents around the world, including obviously Australia and New Zealand. What does that mean? So what are we sort of looking? We're focused on cities that are livable, workable, sustainable, and how do we do this? Is actually looking at what is technology and data, and what can it do to build prosperity? And it's about everyone within that city as well. So as much as it is about economic development, it's about well-being as well. We're specifically focused in those 4 areas: inform, educate, convene, and advocate, and recently have launched the Centre for Data Leadership, which is what I'm going to focus on today. So the Centre for Data, well, part of the Centre for Data Leadership, rather, starting with open data. So we could talk about data in different contexts. We can talk about big data. We can talk about what Michael's just covered around sensitive data, but I thought I'd look at it from an open data perspective, which is data that anyone can use and share. So cities and public entities, just like organizations, have been generating information for decades, obviously, and centuries. But the fact that the computer has become part of that conversation means that actually what they're now generating are sets of data, and we can do so much more by actually drilling into that information, connecting it together, and unlocking the insights that it provides. So specifically around how do you then make that same data set or data sets and make a decision around what's available outside of just your organization, and that's where the smart cities sort of element around open data kicks in. So that it's accessible, it can be analyzed by others, it can be manipulated and appropriately then leveraged by the different stakeholders. So what it means to be open, though, is really important to consider. What does that actually mean for different people? So we looked at the World Bank and what the World Bank considers as being open, and it needs to meet 2 conditions: technically open, so it's available in some sort of format that you can actually access via a computer. And legally open means that it's explicitly licensed in a way that permits commercial and non-commercial use and reuse without restrictions. So that's really interesting. In New Zealand, the open data in New Zealand is sort of governed by or guided by the New Zealand Data and Information Management Principles, which talk about data being open, protected, readily available, trusted, authoritative, well managed, reasonably priced if it's a revenue generation model, and reusable. If you want more information on that, you can have a look at data.gov.nz, and have another, and also if you get a chance, have a look at data4d.nz. So that's also some interesting work happening in the open data space. So how there's open data, but how? So I was asked to give some examples of what we're sort of doing in the smart city space around data, or not necessarily us, obviously, but councils around between Australia and New Zealand, including putting data in the hands of citizens. And what does that mean? So looking at world population from the perspective of citizens in cities. So there are tools, obviously. So in the Waikato, which is where I'm from, as the Smart Cities Advisor for Hamilton City Council, along with, I think there's another 9 or 10 other councils, are part of a collaboration that will feed into the government's initiative as well around open data with an open data portal. So that basically provides not just data sets, but it also looks at policies and sort of guidelines around the use of that data, and it's a public platform. So that's making, and there's examples of students accessing that information and doing things with it and actually presenting that back to council. Council themselves are obviously leveraging the data and making it available in different contexts. Smart View is something that Christchurch has come up with, and I'm just really conscious that we've only got 20 minutes, so I believe there's a opportunity to include links when the video is published. So feel free to then obviously look at some of these things in a bit more detail when you get a chance. So I'm going to skim over some of these things, but SmartView is something that Christchurch City Council pulled together, and it's a real-time data from a range of public and private organisations, so that connecting of data and pulling it together, and it's for locals and for visitors. So again, that sort of, what does it mean for a council, and a council being smart, but actually what can we think of data in the respect of livable, workable and sustainable cities from the perspective of the public. So it doesn't replace other things like Google Maps and transport information available by other apps, but what it does is just combines every little bit of information that might be relevant in different contexts to citizens and puts it on one site. And because it's a website, it's actually quite accessible. The one I want to talk about specifically is WaySafer. Now that's an Australian solution that I believe is still and there might be a space in there, it might be WaySafer. But WaySafer itself as an organisation is they describe themselves as an online safety sanctuary and resource hub for women living and visiting the Logan City Council. So I believe there are plans to obviously scale out from there. But they've I believe it's available, but actually still work in progress in terms of other additions that they're going to include. But WaySafer as an app uses CCTV camera location technology to help women plan safe walking, running, biking routes within cities, so, or within areas really. So it could be towns, obviously, smaller towns, smaller cities. So it's providing a suggested route based on some criteria, and supports obviously women to make a more safe and conscious travel plans and a bit more confident when they're moving around. Going forwards, it's going to include information on street lights and identify verified safe houses and safe businesses, and be integrated with Google Apps, because usability is quite an important element of making any data available for public use. So you've got to consider not the push of data out only, and we'll talk about sort of governance around that, but also how is data consumed, and then thinking of it from the perspective of who's consuming it. And so the co-creation with community becomes really important there, and considering your stakeholders. And so any element of smart cities innovation in any space, but specifically around data, also because the citizens most likely own that data in some shape or some way, is to consider how are they going to consume it, and actually how will it benefit them, and what are they looking for from that perspective. And WaySafer is a solution then that's considered what women potentially might be feeling as they're moving around a city, and how and they've worked with them to understand how a technology solution using data could be leveraged to support them. Bigger than that, though, is digital twins. And so, and remembering these are just some examples, but so across Australia and New Zealand, we're involved in conversations in the digital twin space, including around national digital twins. So if you consider data from the perspective of non-spatial data, so Michael's obviously talked about health data, not from an open perspective, but health data, but there's economic data, there's demographic data, obviously, that Michael's covered as well, and public health information is specifically what he was talking about. But there's also geospatial data, so what's there in terms of elevation, what's there in terms of infrastructure, where is the water, where are the boundaries, and other sort of information that gives you sort of a view of a city or a place. And often digital twin is also used within the context of a twin of a machine or a industrial sort of piece of equipment. But open data as part of then a digital twin conversation becomes even more powerful when you combine data sets. And then again, you're thinking about how the data is to be consumed, and this format is a digital twin. So if you want to sort of, and they can be used from, again, I mentioned about the councils thinking as a smart council, but also with respect to providing access to that data to those that actually want it, whether it be businesses, other organizations, community groups. And if you want to find out more about that, you can have a look at the Digital Twin Hub. So it's just at digitaltwinhub.org, and it's part of the Centre for Data Leadership, which we've sort of launched earlier this year. And the Centre for Data Leadership is really about it's not the be all and end all of data in terms of smart cities, but it's an attempt to sort of connect together members of the community that are involved in smart cities to engage with each other and to think about data leadership. And I'll talk about that now. So why, the why rather, just before that I'll talk about the why. So remembering, so Michael's provided a number of insights in the health space and specifically around women's health and why it's been quite important to consider data and how data has been leveraged and offered a considerable amount of value in that context. So from a city's perspective, again, we're going back to the principles of livability, workability and sustainability. So we're looking at how open data benefits cities and their economies. Specifically. So it's the right of the citizen. A lot of the information and the data, or the data that cities have access to and can share. But and we've talked about the tools, we've talked about the portal, we've talked about Smart View, digital twins is a bigger example, and then there's things like the Waysafer app. But it extends beyond that. So data is valuable and resourceful to fuel innovation as well. So Waysafer is an example of an innovation in that space. And so there's a number of opportunities to drive innovation. And again, I just keep going back to the fact that innovation has to be in collaboration with community, in partnership with community. It has to involve community as much as it is about the councils. So from a smart cities perspective, thinking about data and open data or whatever, we can, I don't even want to go into the big data conversation, but data in general and looking at cities being livable, workable and sustainable. How does the city go about doing this? How does the city consider data in this context and really make a play for leveraging data? So we talk about, at Smart Cities Council, we talk about data leadership. That's more than just the generation of data that's done with all the various solutions that are put in place. It's actually, what do you need to do on top of that almost? So Michael talked about sensitive data and bringing that together and making it available and all that needs to be considered as part of that. So we talk about, in a similar context, these principles, which we call the data leadership principles. So purpose, I mean, that just makes complete sense. It's like, without purpose, you don't even have legitimacy or trust in terms of why it is that you're even collating this data. And if you don't consider purpose, then you really risk losing the value of the data that you've collated. Privacy, so in considering and Michael mentioned security and privacy, but considering that from the perspective of design right from the outset. So rather than an afterthought, you're really taking into account, as you're developing whatever solution it is or whatever sort of considerations you're putting in place around making data accessible for other people to actually develop solutions, you're considering it as part of that design. Same as security. So ensuring all data is securely retained and destroyed at the end of the process is quite important. I think people sort of store and store and store and store, and then maybe you potentially don't even leverage all of that data, but what happens to the data after, and what do you actually do with it, and how important it is to consider security as part of that as well. And to continually assess, I think, is the other important aspect here, the privacy and security elements, so that actually you're on an ongoing basis, the security and the privacy by design are built into any ongoing use and development of whatever solution it is that has been applied to. Ethics is another consideration. So data ethics requires more than just common sense. So we consider the decisions need to think about purpose again, what data should be collected, how it should and shouldn't be used, and who by. So, and that becomes really, really important in an open data context because of the fact that once you've even considered the policies and the guidelines and the practices for making it open, you need to consider who potentially will have access to that data. And governance in general, overall, you're looking at the quality of your data, you're looking at standards that you need to adhere to, you're looking at the systems behind it, the APIs that you're creating, and the standards within those, and which data, which data do you make open, which one's closed, how do you share data? So, and as part of governance, having some real structure in place around roles and responsibilities of information management staff and teams. And the most important thing, and I referred to it when I talked about privacy and security, is to measure your performance and continue to look and review what you're doing against these data leadership principles and consider that as part of your continuous improvement protocols. Now I will just quickly touch on, so we've talked about open data, so we've talked about the fact that councils probably generate a lot of data, and a lot of it is potentially owned by citizens, and so there's a discussion around making it open. The council can use it themselves to innovate, making it open around with providing some guidelines and some structure around that, and using tools for that. Puts it in the hands of citizens. It's important to co-create with your stakeholders. The other form of data, though, is actually data that's generated. So open data can also be generated by things, but the other important element is when things themselves use the data. So the things themselves as a consumer of data. So we've moved now from a discussion in the smart city space around the Internet of Things to actually a conversation around the intelligence of things. So the Internet of Things is just connecting things together using digital means, but the next stage is actually these things thinking and computing right where they are and when they need to effectively deliver smart city innovation. So as part of this computation, they could leverage obviously machine learning and AI as well. If I don't mention that, people that would be listening will be like, left that out of the conversation. But edge computing, so that's a loose term for what I'm talking about, in the sense that it's happening right when it needs to, where and when it needs to. And it's potentially a comparison. You have to consider, is edge computing what you need, or is cloud computing what you need? So and that comes down to time sensitivity. Do you want to do something with the data right there and then? Is one of the sort of considerations. So there's data that we know we have and we capture, and we make a decision about sharing or leveraging it in the smart city space. And then there is data that is generated and used by and between things or devices. And then there's big data, which I mentioned previously, but I won't go into that. So this presents a whole new take on data and open data, as well as data leadership, but it's part of the same conversation. So a lot more awareness is required around what data is generated and what happens to it, because now we're thinking of other stakeholders that we haven't previously potentially considered as part of a data leadership model. The same model, though, still applies, so the same with respect to security and privacy, but there are potentially greater implications. So we're going back to data leadership principles, but we're focusing very much on the process of continuous review. So that's what's important. So considering purpose, privacy, security, ethics, and governance right now, in terms of the data you have access to and what you're doing with it within the organization and how you're pushing it out, and then actually having some sort of governance over how it's used as well to a degree, but also thinking then, how do the same data leadership principles apply as the infrastructure and I guess the ecosystem around the collating and the crunching of data evolves. Lastly, that was quite a lot, I know, and I appreciate the time that I do have. But if you do want to find out more about what the Smart Cities Council is doing, and about those other resources that I mentioned in the talk, I believe, as I mentioned, when the video is produced, there's an opportunity to add links, but specifically around Smart Cities Council and the Centre for Data Leadership, you can see some information on the screen now. Otherwise, just reach out to me via LinkedIn or by email, and I'm happy to chat. So that's my presentation, and I will now attempt to stop sharing and come back to.
All good. I think I've got it. So
right. Sorry. Great.
Great. So we've had a couple of questions come through. So Michael, I'll get you to unmute as well, because the first question is sort of aimed at Michael, but then I'm going to continue it on and focus on your area, Janet. We've had some concerns that people are concerned about environmental aspects of a growing population, but I've seen a graph that shows with better control over women's reproductive issues that you actually, like in time, population will actually decline slightly, like the trend will stop rising and will actually decline as women have better access to contraceptives and their own control over their health rights. But a question came through specifically short term with COVID. We can't avoid COVID at the moment. Do you anticipate population increases? What are the impacts with like restricted access to services and contraceptive issues like domestic violence, other health, mental and physical issues? Like what how will that impact the population, and how can data be used to identify where to help people during that period?
Well, so I mean, the circumstances with physical distancing and restrictions being put in place will make it more difficult, I guess, for people to get access to services. But by the same token, you know, there have been efforts to increase services too through things like video consultations in health services being covered by Medicare. It's hard to know how all of that plays out. In terms of the overall population, I've seen estimates that the Australian population will fall due to the closure of the borders, and I think that would be the first time the Australian population's ever gone down. The other historic suggestions are that birth rates will fall due to uncertainty, etc., as opposed to control over reproductive health, that generally people are less likely to have babies in contexts like this. It remains to be seen with the statistics that come out for that. We have seen a number of things that, not our data, but other sources, that the pandemic and the restrictions put in place have disproportionately hit women because of the industries that have been hardest hit, for example. And also because of the generally more precarious employment of women anyway. And we've also seen, and we do domestic violence statistics, which we take together from all of the justice agencies around the country. I don't think we have definitive figures on that yet, but there is a suggestion that domestic violence rates will go up, and certainly that there's been difficulties as well, but again, the services are responding. But there's been difficulties for people reporting due to the nature of the shutdown, for example. So there are challenges through this period, and it does look likely it's going to have a disproportionate effect on women. In terms of population growth and the link to the environment there, the likelihood is that birth rates will decline in this period based on previous economic and health declines. So history suggests that, but we're a long way from having those statistics. I imagine that social distancing and restrictions on social activities are also going to have a long-term effect on those. Yeah, and the economic impacts will also have a long-term effect on that, on birth rates.
Yep. And I'll throw over to, thanks for that, Michael. I'll throw over to Jannat now. So IoT devices, and like you got a better view of what's happening in your city, and you're collecting all sorts of data, and there's some really clever ways to manage your city. There is this concern about creep out into the environment and as our cities expand. Like, is there some data that we can collect that shows how we can better manage this and make sure that, you mentioned stakeholders, how can we make sure that people who are concerned about the environment can be part of the conversation about city management? Can they get access to data? Like, what can support their argument for how to plan out a city?
Yep. So that what I mentioned around spatial data. So spatial data is actually data about your environment that's available in a digital format. So we, as cities use a lot of that to understand to run scenarios, run simulations. So if you think about a digital twin, the purpose of that is actually to be able to have a digital version of your actual environment and being able to run scenarios on what it would look like if this happened, and then to actually load on that. So if you built out, then load on that the movement of traffic that you know from previous pieces of information that you have, and then run scenarios of traffic running and run scenarios of people moving around and mobility. So that's a potential of a digital twin. So even without a digital twin though, there's spatial plans being conducted even now, for example, for a number of regions in New Zealand to understand the impact of population growth and inner city living and actually building in the city, and then actually what the potential is for building out. But on a less, I guess, IoT note, but more around the co-creation with the community, Hamilton City Council led a conversation that they were highlighted for in New Zealand around how they went around this project to do with LED lighting. So I believe there was a subsidy available from the New Zealand Transport Authority, and then councils were part of conversations to upgrade their lighting to be more obviously cost efficient and also more sustainable. So it was moving to LED lighting. But Hamilton City Council took a real co-creation approach to that. So we talked to I wasn't involved, but I know about it, but talked to the observatory, because obviously it impacts the fact that you can't see stars as clearly and galaxies as clearly, and whatever the observatory community was keen on. But also residents, and how did the light actually impact just their house? So how much light was actually coming in and flooding in through windows on streets. And then the third one was actually the museum. We talked to the museum about the bat colony, so the resident bat colony, and actually what was the impact of the lighting. And so there was a lot of conversation and focus groups and consultation. And the other cities around there was a couple of other examples of this in New Zealand, where we've really understood that moving forward with technology innovation needs to include those key stakeholders in the conversation. And actually then the worst you can do is actually then involve those stakeholders and then disregard what they've said. So you've got to be ready as a councillor to adopt and accept then the feedback that you're getting. And that's a really important sort of consideration. People often do co-creation and consultation of stakeholders, but it's really more of a tick box exercise. And I think in the conversation around open data, the first consideration that you have to have is whose data is it and who will have access to it if you make it open. And then essentially what will they want to be doing with it, so you can actually consider all three things as part of what you release and what format you release information in, and even what tools you make available. If it isn't data, what tools are you making available to enable livable, workable and sustainable cities?
Yeah, absolutely. And I think we're pretty much run out of time, which cuts off my next question, which I think you kind of covered in that, how can you help other communities? Like in New Zealand, you've got fantastic data gathering, you've got fantastic groups. Michael, with the Australian Institute of Health and Welfare, like you said, Australia's got like one of the best health systems around, very advanced in terms of data collection. There's other countries that don't have access to those. Just because we're running out of time, do you have one tip from each of you as to how other countries can benefit from Australia's, from what Australia and New Zealand are doing? So Michael, I'll just start with you quickly.
Well, I mean, I think at some basic level, a lot of this stuff is very costly. So the countries that don't have those systems in place, it's going to take investment to get that up, and that's part of how it's happened in Australia. Ours is so much as well tied up in funding arrangements, and basically the Commonwealth requires a lot of data of the states to get money to help fund hospitals and things. That won't necessarily pertain elsewhere, but there are a lot of people who are doing better data than us for those same reasons. Our system that works like that is a bit fractured, and so therefore it's harder to get data sometimes. So I think I guess the key tip is to just value it and show that value, and do what we're trying to do now, which is to explain how it does lead to better lives, and also, when it's costly, if you're talking to government, then how it saves money. And that's where you'll find the money to do the data work, because it's always probably cheaper to do the data work than it is to just let things run.
Yep, that's a really good point. And Jannat, just a quick tip from you.
Talk to others and connect. So it's easier in the smart city space, I guess, because we're sort of a leading global organisation. So join the Centre for Data Leadership, find out what the Digital Twin Hub's about. That's all about data for cities and co-creating stakeholders, including technology partners. But even outside of that, it's about talking with others that are on a similar journey with you, and actually co-creating almost the solution, and saving sort of on that brain space and spend that happens when you're actually going out on a limb and trying something without sort of that, I guess, forethought and knowledge sharing. Yeah.
So connecting with others and highlighting cost benefits. I think they're two really key points. So we've run out of time, unfortunately. I could chat about this for ages, but unfortunately we have run out of time. For those people watching who are interested in more population things that are happening in order to address issues, in November is the big date where the United Nations Population Fund we'll get together with several governments and are hosting a high-level conference in Nairobi. So keep an eye out for that. Otherwise, we've got some other webinars we'll send some invites out for, including, as I mentioned, World Indigenous Peoples Day, which is very close to all our hearts. Otherwise, thank you, Janet. Thank you, Michael. Thank you very much. And we'll send this video out. We'll make it available to people, including the links that have been mentioned. So thank you, everyone, for joining us, and happy World Population Day. Thank you.
Great. Thank you so much.
Bye.
Thank you.